Okay, so our patient is a 1-year-old patient. She's been vomiting for the past 12 hours and has not held anything down per her mother. So she hasn't had a wet diaper since 7 a.m. and it is now 5:30. So that's quite a long time with no wet diaper, and that's really worrisome. So her mom also says that she's very lethargic and quiet. Her lips and skin are dry, crying at times, but does not produce any tears. Her diaper is dirty, or her diaper is dry. So my concerns based on just that is I'm worried that she's vomiting and not holding anything down, as well as her diaper being dry. So this is a huge, huge, huge indication of dehydration, especially with the fact that she is producing no tears at this time. Another thing that I'm super worried about is that she's lethargic and very quiet. So if mom is noticing that kind of change, that's something that is concerning because we don't know the child. So we're just really solely basing her affect, her behavior on what the mother or father is saying at this time. So during the exam, it's noted she's lying very quietly on the table. Vital signs are listed below. Physical exam is listed below as well. I'm not going to read through that right now. But from those findings, I'm concerned because her temperature is elevated. Her heart rate is slightly elevated. Her blood pressure is a little bit low. She has lost weight from her 1-year visit, which was 2 weeks ago. And she does have left tympanic membrane bulging, and it's erythematous. So maybe an infection possibly going on there. That's going to need some more assessment. She is showing chest congestion with coarseness and expiratory wheezing and a dry cough. So again, that's something that's kind of worrying. Need to figure out a little bit more from that. The GI system sounds good. Genitalia is noted, no drainage, just worried about the urine again. Musculoskeletal is all fine too. So her mom says that she loves her milk, drinks 40 ounces per day, but in the 24 hours has not wanted anything to eat or drink, which is a sign, not being hungry, kind of being fussy and stuff like that. That's a sign of the kiddo being sick. So we're going to kind of look more into that. The mom's asking if there's anything that the nurse can give Allison to help stop her vomiting. So at this time, we kind of want to keep the kiddo NPO because we don't know exactly what's going on. So we're worried because there is other stuff going on. We don't know what medications we're going to need. We don't know what tests we're going to need to do. So we're going to keep that kiddo NPO for now. So not really anything at this point that we would give her for vomiting. How does the nurse ensure that Allison has been correctly identified? So looking at the child's wrist bracelet and asking the mother her name and her birthday. What care does Allison need at this point? So I agree with the mom. We need to kind of monitor that vomiting, but we need fluid replacements. We need possible antibiotics, something to lower her fever. We're going to need more testing, so maybe a chest x-ray for those chest problems that she's having, further assessment of her ear, antibiotics probably for that, and lab values to see what kind of things she might have going on. During the insertion of the IV, Allison lies quiet throughout the procedure. So this is super concerning to me because she is a little kid and they do get scared. I get scared when I get an IV and I'm 22 years old. So this is most likely because she's super sick and super dehydrated. So we need to start looking at interventions quickly because it's super concerning to have those kind of things going on and not have her be worried or crying. Why does the nurse repeat the weight she just had done in the office? So we need to find a correct exact weight for right now, because medication administration is super important when it comes to this, as well as knowing the correct fluids to give her and all of that stuff. We need to know how much she weighs so that we don't have any kind of errors. What diagnostic tests are warranted by these findings? So again, like I said before, we're going to do a lab value, possibly a chest x-ray. There could be other diagnostics, but I would probably do the chest x-ray and a CBC, kidney function maybe, because of the dehydration, and a urinalysis because of her vomiting and stuff, and kidney function. She just hasn't been peeing, so when we get that urine, we need to test it to see what's going on. So it says she was given a fluid bolus and she perks up, so the doctor orders Tylenol. So the doctor orders acetaminophen 650 Q4 hours. So this is not appropriate for Allison, especially because she is too little. 650 is like an adult dose, and we would never give that to her, especially because, she has been vomiting and all that stuff. Like, it's just not good. So as a nurse, you need to go to that doctor, that physician. You need to say, hey, this is not correct, especially because it's too big and we could hurt her. So kind of just asking for a different dose, different medication possibly. So it says here to calculate Allison's daily maintenance fluid requirements and expected hourly output. I had a lot of trouble figuring this out because I was just kind of confused. I found that 1,500 milliliters of fluid per day seemed to be across the boards everywhere for these kids. Probably since she's dehydrated, we want to kind of push that a little bit more with our fluids. And it says online 2 milliliters per kilogram per hour for that child. So since she weighs probably 21 pounds, we would say probably like, around 20 milliliters of urine every hour, I guess. But I did have trouble finding that one. Yikes. So then it says the doctor changes it to 120 milligrams PRN Q4 hours, but the nurse has acetaminophen 80 milligrams per 1 milliliter in a liquid prep. So you'd give 1.5 milliliters for that child to get that 120 milligrams. So it says the doctor also orders 250 cc NSS IV bolus stat. I think that this is good to give that to that child. We just don't want to hang it too high, and you want to make sure you prime the tubing so you don't get any air bubbles, and spike the bag correctly so that there's no occlusions or anything. We want to possibly give that child the board to put on their arm so they don't bend it or anything like that, so that those fluids go in. And especially we want to check skin integrity because she is dehydrated. So it's also asking about IV fluids with additives in them. So since she's been vomiting and been so sick, I do believe that electrolyte supplementation would be indicated for this child. It would be fine. We just want to make sure we're not giving too much because we don't want her to get hypokalemic. So what are responsibilities when administering meds? So giving the child the right med at the right time, the right dose, the right frequency, right route, making sure completely it's the right patient, because we don't want to have any medication errors, especially because this child is so sick. So it says her temperature is now down. She has a wet diaper, and the mother asks for a bottle. The lab values come back as followed, and those are listed below. The hemoglobin is low, creatinine is high, CO2 is high, VUA has leukocytes and large amount of ketones. This is indicated in dehydration. Blood glucose is kind of low. So those are kind of worrisome. We're going to keep monitoring those. It's asking what diagnosis is Allison being admitted for. So I believe she's being admitted for the pneumonia, but also a complicated dehydration, as well as monitoring her lab values that are off, because she is having problems with her kidneys from the sickness. So we want to continue to monitor her and give her the correct fluids and make sure that we restore her kidney function. So what should the doc consider when ordering meds for Allison? So we want to make sure that the doctor is cognizant of her kidney functions, because some medications, such as NSAIDs, might have an effect on her kidneys and her liver. So you want to be very worried about that, as well as her blood glucose. We don't want to get her to be any more hypoglycemic than she is, as well as her weight. So the doctor needs to be cognizant of her weight, because we can't be ordering any crazy meds for how small she is. Using the S-bar technique, I, as an ER doctor, would do a situation is a 1-year-old being admitted from ER with complications of chest breathing, as wheezes and crackles, chest congestion, a positive chest x-ray for left lower lobe pneumonia. We have a background of vomiting for 12 hours. She recently hadn't had any wet diapers, but now has had a wet diaper. Her fever was 101 when she first came in, but now is at 99.4, 99.2. She has been given Tylenol, 120 milligrams, 1 dose. And she is now starting to perk up a bit, as she was lethargic before. And her lab values came back as hemoglobin 11, white blood cells within normal range, potassium 4.2, sed rate 10, creatinine is slightly elevated, BUN is within normal range, CO2 is slightly elevated. The UA shows small amount of leukocytes and large ketones, but is negative for nitrites. She is still waiting on the blood and urine cultures, and her blood glucose is slightly decreased. And we're assuming that that's from her dehydration. She was given a normal saline bolus and took that well. She had a chest x-ray, which was indicating left lower lobe pneumonia. And my recommendations would be to continue with the Tylenol, continue with the fluid replacement. She might need a follow-up chest x-ray, as well as antibiotics that might be prescribed to that patient. And we are also waiting for blood cultures to see kind of what meds we should give her, and to continue trying to push oral fluids. And that's that. So after receiving report, the floor nurse admits Allison to the peds unit. Allison's stable, napping in the room, mother's settled, and goes to the nursing stations to fill out the paperwork. Hey, I know this family. They live right up the street from me. What is she here for? So an appropriate thing for the nurse to say to the secretary is that I can't give you that information because I'm not allowed to go and give my information for my patients because of HIPAA. So I'm just going to say at this time I can't let you know. Obviously, if the secretary wants to go ask the mom, she's going to go ask the mom anyways, but that's not my place to give that information.